Hello, my name is Kathy Quarles-Moore, and I'm an associate professor at the University of South Carolina College of Pharmacy. I'm also a practicing independent community pharmacist, and today I'm going to be guiding you through some of the top 300 drugs that we use in community pharmacy. In this section, we'll be talking about dermatologic agents. These are things such as creams, gels, and lotions. And you know, creams are a little thicker than lotions, and gels are a little more water or less viscous than creams. So we're going to talk about these medications that can include indications. You know what indications mean, I'm sure. It means what it's used for. Some things can be used for acne and rashes, things like poison ivy, poison oak, poison sumac. And there are many different formulations of the topical medications and many different skin infections that they can treat. So that's what we're going to be talking about in this section.
A topical corticosteroid, Clobetasol, the generic name for Clobex or Timavate. These are indicated for inflammation and rash. Some of the side effects of this drug are skin thinning, pigment changes, irritation, and possible contact dermatitis. So the main thing with this drug, when you talk to your patients about it, is to make sure that they apply a thin layer on the area that's affected. You want to tell them to avoid the contact with the face, eyelids, and genitals. Just a small amount. And one thing I tell my patients too, don't cover this area with plastic or a Band-Aid, leave it open. Another topical corticosteroid is Mometasone. Brand name is Elicon. The indication, again, is inflammation and rash. Side effects are the same as the other topical corticosteroids. Just note, thin layer. And this is a medium potency steroid. Another topical corticosteroid, Triamcinolone. The brand name is Kenalog. It's also used for inflammation and rash. Same side effects, same notes. Another topical corticosteroid, this is a combination drug, Clotrimazole, Betamethasone. Okay, let's talk about this for a second. Betamethasone is your topical corticosteroid. Clotrimazole is your antifungal. This has the brand name Clotrimazole. Zone being the betamethasone, the clotrimazole. You can kind of sideways get this, the LO, Clotrimazole, and it's used for dermatologic fungal infections. It can cause the same thing as the other topical corticosteroids. You want to make sure that you tell your patients it can cause the skin thinning, pigment changes, irritation, and possible contact dermatitis. Also, you want to make sure that if the skin appears healed, you use it for 2 to 4 weeks and limit moisture to the area, especially if this is used for athlete's foot. Very important. A lot of times, think about this for a minute. Why would we use this for athlete's foot? Fungus infections or fungal infections of the foot cause a lot of extreme itching and redness and irritation. And so that's why they've combined the antifungal with the topical corticosteroid. So just note, that's just a cool fun fact. Topical retinoic acid derivative used for acne, Tretinoin. Topical is Retin-A, and I know Retin-A is the brand name, topical brand name Retin-A, Tretinoin. It's used for acne, and a really important thing to tell your patients about this drug is they need to apply just a pea-size amount at bedtime, approximately 15 to 20 minutes after they wash their face, and it may take about 4 to 12 weeks to get better. Now, another thing too is to let them know that the face may get red and the acne may get worse before it gets better. If you do not tell them this, they may stop using it, okay? And when they go in the sun, they're supposed to wear sunscreen, very important. Side effects, skin thinning, pigment changes, irritation, and possible contact dermatitis. Another topical retinoic acid derivative used for acne is Adapalene. Brand name is different. It's used for acne, and it has the same counseling points. The acne and the redness may get worse in their face before it gets better. You have to let them know, and you only need a pea-size amount. Same side effects. One thing about both of those is you have to avoid them in pregnancy. and you also have got to wear sunscreen. Very important. Oral anti-neoplastic retinoic acid derivative used for acne is Isotretinoin, brand name, Accutane, Clarivis, Myorsan. This is for severe refractory acne. This has got a huge black box warning, this a teratogen. So we have a lot of things we have to do for this drug. We have to follow the REMS protocol to prevent pregnancy. 2 negative pregnancy tests required prior to starting, and must have a negative test each month prior to prescribing. Also, the patient must not get pregnant for 1 month before, during, or 1 month after stopping the treatment. 2 forms of birth control are required. This has got to be documented. Very, very, very important. Some of the side effects: dry skin, and I'm not talking just a little dry, really dry, and really chapped lips. Dry eyes and eye irritation, psychiatric disturbances are possible, and the hepatic enzyme elevation is possible. Also, you need to tell your patients to avoid taking with any fat-soluble vitamins like A, D, and E, because they may enhance the toxic effect of this drug. All right, so this drug, you have got a lot of counseling to do with your patients taking this drug. Very important. You have to make sure the documentation's here, asking about birth control. I mean, I double ask it. The doctor's already asked it, but I double ask it because I've got to document everything I've talked to the patient about.